We're here with Kimberley Wilson. Thank you so much for joining us today. I know that our conversation started way before I pressed the record button because there's so much to say, and I feel that there's a lot of overlap between your message and our message. And like I was telling you earlier, the thing that stands out for us on your page and on your information source is the fact that you are, first of all, evidence-based, and second, you really give a lot of time to explain the relevance of context when it comes to mental health and brain health. And you're not afraid of nuance, of complexity, and absolutely love the message that you share with everyone. And we're so happy to have you here with us on our podcast.
Thank you. No, it's a real honor to be invited. So thank you very, very much for having me.
You've written amazing books. Your book, Unprocessed, How the Food We Eat is Fueling Our Mental Health Process, is incredible. And in it, obviously, you give a lot of information about the connection between food and mental health and the relevance of what we do every single day to take care of our brain health. What inspired you to delve into this topic?
I think really the clearest moment in my mind is when I was working in prisons. And so I was running a therapy service at what was at the time the largest women's prison in Europe. And some of the idiosyncrasies of working with female offenders is that even though they only made up at the time about 6% of the overall prison population in the UK, they accounted for an overwhelming amount of the self-harm. Somewhere close to 50% of the incidents of self-harm were from the female estate. And so part of my role was to sit in the safety and security meetings on a weekly basis and with the other members of the prison staff, work out who was at risk. Was there a risky time coming up? Were there court cases coming up? Were there anniversaries, Mother's Day, Christmas? All of these are kind of risky times in terms of self-harm or violence or just agitation and a mental health decline. And so always risk and safety were on my mind, as well as thinking about what's happening with my caseload and my team. And it was around that time, around 2010, that a replication came out of a study that had first been done in 2002 in the UK. And then it was replicated in the Ministry of Justice in the Netherlands. And it was a double-blind RCT on the use of nutritional supplementation in aggressive male offenders. And they found, what was really interesting about both of these studies was they found a very similar magnitude of effect. And that they were looking at objective incidents of violence. So it wasn't just subjective. Do you feel violent today? Do you feel like punching John in the face? It was really actually going to the logbook at the end of the wing, counting how many infractions there had been, and then comparing that with the placebo wing of the prison. And they found an average of about 30% reduction in violent incidents in these supplemented groups. And so that was the 2002 UK study. One in the Netherlands. Had been an older US study done on young offenders. And there was a similar study done in Singapore more recently in the early 2020s. I think there's another one underway in Australia. But, a series of RCTs showing that the potential for a simple, very cheap, low-risk intervention to have some impact on a huge problem in prisons, one that causes staff sickness, more risky behavior, extended sentences, all of this sort of stuff. The idea that something as simple as improved nutrition could potentially play a role, I thought was incredible. And it was really relevant to my work. And so that's when I really kind of got started thinking about this area of research and this kind of evidence base.
Fantastic. And then what was the nutritional intervention in each of these studies?
So it was, they were nutritional supplementation, so vitamins and minerals, so broad spectrum micronutrients. I think one study used omega-3s and vitamin D as well, but mostly vitamins and minerals. And against placebo, for a minimum of 2 weeks, average about 12 weeks, and they get this kind of very similar magnitude effect.
Wow.
That's amazing.
Sorry, being a scientist, immediately in my head, things pop up as confounders. there's a tremendous number of potential confounders in a study like that, because, you know, the observation bias that when you're in a study, you're being observed, even though that's a blind RCT, as you would expect. There's been evidence of seepage and leakage of bias. Do you think that they've controlled for all those factors?
I think they've done a pretty good job. So all of the studies were at least double blind. One was triple blind against placebo. Yeah. The placebos were very well matched in terms of kind of the appearance and all of that stuff. And I think in the analysis of whether they knew whether they were on the placebo or not, there was no significant difference between those two. So, you know, within the constraints and the confines of this kind of environment, I think they've done a pretty good job. Of course, you know, we need more. But what's really interesting about this group of studies and the environment is how little interest there has been in replication, actually. You would think with a magnitude of effect like that, even the fact that it is extraordinary would lead other people to say, listen, let's have another look at this. Let's just dig into this and see what's happening. If we can replicate it and if we can't, because that would be really important. But what's really interesting, and I think it's to do with the population, is how little noise this kind of research, this kind of outcome has made. I think if we were talking about a general population, so if we were talking about, I don't know, at-risk teens or people on anger management courses in the general population, we said, listen, there's a pill that you can take that will potentially reduce your outbursts and improve your impulse control. I think there'd be a lot more noise made about it, but I think there's a real reticence and an actual active disinterest in a prison population. And so, yes, I absolutely take your point, and it'd be lovely to have more applications of this work. And it's very interesting that there haven't been.
I mean, just the nature of science, you know, on social media and in the media in general, anecdotes take over space, and anecdotes are the lowest level of, I mean, they're science, they're useful, but they're useful as far as just instigating the next step. You don't make conclusion, but in social media, one anecdote and everybody's jumping on it. It's like, oh yeah, there, coconut oil. There it is. It's going to cure everything. One case. But it is valuable. But when you have RCTs, that even if you are incredulous about its power, let's say, although statistics would take care of it, that should have definitely prompted further follow-up.
Absolutely.
The fact that there's so little follow-up tells you not so much about the study, but about the biases of the funding agencies. The a priori biases of funding. We did a study. We were one of the PIs in Arizona where they looked at nutrition for addiction. Those people who come to a facility, in-house facility for addiction, whole food plant-based versus regular food. And we saw a signal, and we wrote it up, and it was written up, and the first author wrote it up and all that. And even there, we said, it's just another signal. It should be further worked up and all of that. But if it's not followed back, it says something to the fact that it's not that people don't have interest. They actively don't have interest. That means that they have preconceived notions that they don't want to explore. And it's such an easy thing to both do study in, and also if it works, such an easy way to curb behavior.
Win.
Yeah, it's a win-win.
Easy win. And I mean, off the record, but on the record, I have spoken to journalists who have tried to follow up these studies, you know, either talking to the Home Office, talking to people who were there at the time, and they have got the message very explicitly that we're just not interested in this kind of thing. Yeah. And that's, for several reasons, that's really frustrating. First of all, it's just a kind of dismissal of an entire population of people. It's a dismissal of what could be really relevant science, not just for this population, but for people more broadly. It's not just prisoners who are nutritionally deficient. Actually, we have a lot of people on the outside who might be benefiting from these sorts of investigations or from the outcomes of the research that comes from the follow-ups. So it just feels like an abandonment of a responsibility to just not do anything with it. The UK study was done in 2002. So we are 20 more than 20 years on.
Oh my
and
gosh.
nothing has been done.
Yeah, we did a study, a comprehensive review on omega-3 and the developing brain,
And another comprehensive review of omega-3 and the aging brain. And it was
Supplementation.
It was supplementation. And it was comprehensive, the methodology of 2 reviewers, all of that. So it was pretty extensive. It was published, and we were very circumspect about the results. The results showed trends, and we said it showed trends, and that we're okay as science. We're okay. We don't have to be binary, yes or no, work or no work. The trends matter, and the effect on omega-3 and the children was actually that was more powerful than on the aging side, and yet there hasn't been as much work on. If not omega-3 as pills, awareness and cognizance of omega-3 content foods, we're plant-based. We're whole food plant-based. Even, especially amongst the population that are whole food plant-based, you have to be extra aware. This is not a weakness of the diet. It's awareness of all of humanity, that all of us have deficits. So what a wonderful work you're doing.
I don't know where to start with the preconception, early life, nutrition, the huge gap between the research outcomes and recommendations and actually what's happening in the world is terrifying.
It is.
It's what I was reading today. It's less than 30% of UK women are taking their folic acid. I mean, it's so worrying. And that's, one of the nutrients that everybody knows about, we're well aware. Even people who aren't even thinking about becoming pregnant know about something about folic acid. But then there are all the other nutrients, like making sure you're getting, omega-3s aren't even really recommended in terms of ensuring you've got adequate supplementation during preconception and pregnancy. In fact, we don't even talk about preconception. But iodine, choline, like all of these key brain building nutrients are either missing from the preconception supplements altogether in the case of choline, or just not likely to be recommended by your healthcare professional. And the evidence is there. We know these associations there, particularly for the early parts of gestation. It just beggars belief. We're letting people down by not giving them this information, and then the children end up paying for it.
Absolutely. I think that's such an important point. You were talking about iodine, and Dean and I have actually worked outside of the United States in multiple different countries like Afghanistan and in several countries in the continent of Africa. And iodine deficiency and goiter seems to be the #1 reason for an element affecting cognition in children and in adults. And yes, in the Western world, we never think about it because our foods are fortified and, the quality of food and life is higher than what it is in, say, for example, in a country like Afghanistan. But iodine, just a supplementation of iodine can affect IQ. People actually can have lower IQ levels and significant mental decline because of deficiency of a food that is easily replaceable. So I agree. I mean, I think the messaging has to be out there, and there has to be better way of informing people to take care of themselves. And I also feel that we shouldn't put the onus and the responsibility on individuals alone, but there have to be a systematic way of us sharing this information in a public health announcement kind of way so that they're more aware. And I don't see that happening quite often. Why do you think that is? Is it because it's not incentivized? There's not a lot of financial reward into it? What may be the reason for it?
I think there are a few things. I think there's a way in which, and I suppose there's a balance that needs to be struck between over-medicalizing pregnancy and early life, but also the thing at the other end where there's this kind of assumption that it's all natural and the body will take care of itself and don't worry. And actually... Actually, it's a bit more complicated than that. And I think perhaps I think really the government isn't really making that link between population nutrition and mental health. There's a real gulf around the relationship between nutrition. And when we think about nutrition, we're generally thinking about aesthetics. People are thinking, will this make me fatter or will it make me thinner? is the first question. And then you've got the kind of longevity crew who are thinking about trying to live to 120. But people are very rarely thinking, is this thing that I'm eating, or is my overall diet contributing to me staying sharp in my 70s, me being able to continue all of those activities of daily living and taking care of myself? And so we don't do that in the general population. We absolutely don't do that at government level. There is not that connection. Last year, we had lots of changes in our politics last year. So, but one of our outgoing health secretaries, before he left, said, I'm gonna have a very ambitious plan for dementia. This is our ambitious 10-year plan for dementia care, dementia prevention. Nowhere was nutrition mentioned. Even when we had these very clear associations about diet quality and risk, this thinking isn't happening at the levels of policy. And so I think when we take that back all the way to pregnancy, people aren't thinking, actually, the government isn't thinking, what people are eating now is going to affect, the IQ scores of the children in 10, 15 years time, which will affect GDP, because we know that IQ tracks with GDP, with lifetime earnings. And so we're just missing the connections between what's known and what's professed, I think.
Right, right.
It's so funny you say that. I mean, like I said, Aisha said, we were creating the healthcare system for Afghanistan and several countries. And the first thing you jump to is nutrition and fortification. Yeah. and in the West, there's the two sides of things. One is the naturalistic bias, right? Oh, if it's not natural. Nope. Evolution didn't care about you living past 30. Realize that. It didn't even care about you. It didn't even care about you thriving, cognitively. If 15% of your population was hypothyroid and had a cognitive deficit, it could still reproduce.
That's true.
And still could, hunt and forage or whatever. So we are cheating the system. That's okay. The other extreme is when people jump into exaggerated manipulations. And we see the other side as well, extreme. Data-driven evidence shows that, yes, we have to folate, we have to be aware of our iron, we have to be aware of iodine, we have to be aware of B12, these kind of things, and vitamin D and on and on. And we have to just be aware. It doesn't mean that you have to jump on the bandwagon of polypharmacy, but we have to be definitely aware. And the lack of motivation from the government side is, I agree with you, there are multiple reasons for it. In fact, in the United States, there seems to be counter interests that resist change as well, as far as food is concerned and things of that nature. So it's a complicated situation. We had a conference last week for AAPA, American Academy of Physicians Assistants. There were like 5,000 people in the audience, and they thought we were going to talk about dementia at the end. They said, what is one thing you would focus on as far as public health that would have the greatest impact? And they thought I was going to talk about dementia. I said the first 5 years of life.
Yes. Yeah.
Those determine finance, that determines success, that determines happiness, that determines longevity, that determines dementia risk. Everything is those first 5 years. It's so beautiful you said that. But yet we don't focus at all.
There seems to be, and I used to have a supervisor who would say, she would talk about what she perceived to be a kind of contempt for childhood. This is and a kind of almost a hangover in the UK of a kind of Victorian children should be seen and not heard, and that's shifting now. But a way in which we don't really think about childhood. Childhood is just a kind of inconvenient step before you become a productive, money-making adult.
Yes.
And you just need to be kind of clean and organized until you get to that point.
Yeah.
And, we were seeing the pointy end of a lot of childhood experiences, but there doesn't seem to be that kind of reverence or valuing of early life, of pregnancy. I guess, you guys have even worse maternity leave than we do over here. So there's this kind of way in which, you're expected to just get it out and then pop back to work. And we're not really interested in actually how important this time is, not just in terms of the nutrition, but certainly from a psychological point of of view, that early formation of the bond and being thought about and held in mind and developing of the relationship and learning to think about oneself, all of that happens in the context of a loving relationship where parents have time to spend with their children. And I think our economics and our political system is so focused on the productivity of the individual that it kind of misses the family. And I think a balance needs to be struck between those demands.
But it is productivity, though. But it's short term. So, I mean, as far as productivity, nothing actually increases productivity more than investment in those first 5 years.
Mm-hmm. Yes.
We talk about leadership. I did a PhD in leadership. Your leadership is learned in home, the first 5 years. We have to take classes and classes for driving, but nobody, there's no investment in teaching parents how to interact, how to converse, how to reward, how to empower, how to give tools, how to put one step right in front where it doesn't feel overwhelming, yet how to create courage, how to create fearlessness, how to create, all those things are incredibly important, even from a very capitalistic perspective. There's nothing more productive toward that capital, later capital, than those first 5 years of knowledge in the household, knowledge in the community. We don't do anything in investing time, giving the mothers time to build those relationships. I agree with you. I mean, this conversation was somewhere else, but that appears, well, you're getting married soon. And we just had our 19th anniversary and our teenagers are on their way out. So it's critically important. I agree with you, especially nutrition. And talk about an easy input. Wow. An easy, ubiquitous input.
Absolutely. Because, I mean, I never want to give the impression that I think nutrition is a panacea. Like, you're terribly depressed or you're on the verge of a panic attack. Just have a carrot. Like, I never want to give people that impression. But what is important about the influence of nutrition on brain health is that of all the things that we know that contribute to things like depression and dementia, so our leading causes of disease and death in the UK are, disorders of the mind, depression and dementia, Alzheimer's disease. So we know that these are multifactorial conditions, that it's about early life, it's about genetics, it's about poverty, it's about ethnicity and the way the world responds to you and treats you. It's about, your access to green space and to healthcare.
Yeah.
Thing is, I cannot create new social housing overnight. We cannot shift our economic system overnight. But actually something that can, when there is sufficient will, be shifted very quickly is nutrition. We can, whether that's through supplementation or whether that's through subsidies, we can shift nutrition very, very quickly. And, there was often the excuse beforehand, process policy takes time, implementation takes time. What COVID showed us is that actually we can implement things very, very quickly when we have a sense of urgency about them. Yeah. We had policies that were written overnight. The ink wasn't dry and people were having to shift the way that they were working or living. And so we know that we can work with alacrity when there's enough will. And it's that will part that is missing.
Absolutely. And I think the will part comes from enough evidence showing the impact of an action on an outcome. And I so appreciate what you just said right now about mental health and the relationship between food and where we are right now. As you're aware, Kimberley, you're on social media and we are as well. I mean, it's so sad to see, talking heads simplifying the impact of nutrition on brain health or not looking at the bigger picture of all the other factors that come into play as well. Like you said, culture, age, gender, societal influences. We always resort to simplistic statements like, oh, if you eat turmeric, your depression's going to go away. Or for example, soy can cause depression in men and feminization in men and things of that nature. So we live in a world where
sound bites
work. and everybody base their lives, their decisions of how to live a life based on these sound bites. And in a world where there's not enough time to sit down and look at a complex picture or listen to a complex conversation and see where you are in that complexity and then making a decision. How do you, I guess this is not a fair question because it's a very, very big question, but I'm sure you would agree that there is a big problem, isn't it? I mean, it's so worrisome to see people simplifying such a complex message and then expecting people to understand it, isn't it?
It's bewildering and it's terrifying. And I talk about, I start a lot of my videos by saying, as you've heard me say before, it's complicated.
Yeah.
Because I think of as a campaign for complexity, that we need to understand that nothing, particularly nothing in terms of mental health, is straightforward. There is nothing about biology to start with that is, as you say, binary. It's never if then. It's always a spectrum. There's always overlap and merging and interactions that we haven't even calculated in order to be able to account for. I think about a lot of our media and the information that we consume now is ultra processed. Everything is already pre-digested for you. We have apps that, you don't have to read a whole book. Why would you bother reading an entire book? Somebody else has already read it for you, or there's an AI that's done it for you. And here's the bits that other people found interesting. So we've just given it to you pre-digested and you just, kind of slurp it down. But it deprives everything of meaning. And I have an online book club that I call Thinking Space for that reason. Like, let's read a book and then let's think about it. We don't have to come to any conclusions. We don't even need to say whether we like it or not. It's not even about that. Let's have a space where we can just think about ideas. And I think we've really, really lost that. We've lost the opportunity for what I call like thinking in public. Maybe that's not my phrase, but I quite like it. That kind of, which is different from debate. It's different from, and actually most of our debates aren't even really debates anymore. If you watch a TV or news debate, actually they find someone on one extreme end of the spectrum, and then we find another zealot from the other end of the spectrum, and we sit them down in front of each other and make them kind of throw rocks at each other from across the coffee table. That's not helping anybody. No one is learning from that experience. We're not learning to listen. We're not learning to argue. We're not learning how to form a thoughtful conversation. We're not learning to kind of respond to the central argument. We're not doing any of that. And I think in a lot of the way that we approach debate and conversation now, it's really about just trying to convince your base, to kind of reinforce something that you already know. But also, it's almost as if you're trying to diminish the other person. You're waiting for that opportunity to get that zinger in, which means it's never in good faith. And so someone can't come with vulnerability or they can't show that they're unsure, And actually, all of good conversation and learning is about being unsure and working something through. And, let me check this. Am I understanding you right? Let me just double check that. And if we don't have that as a model, if I can't turn on my television and see that happening, and if we don't have that in our schools, then I don't know what happens.
Yeah. It's the battle between, I say the battle of humanity is 2 inches apart, between the limbic system and the frontal lobe. It's the emotional certainty-seeking brain and the complexity-seeking brain of frontal lobe. Ironically, the safety-seeking brain is more powerful, the emotional brain. That's why, in fact, many of the talking heads on social media, if you see the one that go really high up really rapidly, are the males that are very certain about what they're saying. And they say it in a certain way, in a calm, collect, very, very certain way. And nobody checks their data.
Sometimes without a shirt. that actually drives the message very quickly.
It's
apparently if you don't have a shirt on and if you're really, really confident about your statement, it sticks.
It's like, why are we not more critical of the idea that someone is walking through a supermarket aisle with their shirt off, shouting at vegetables? Like, I don't understand why.
It's crazy. And I'll tell you, on the other side, we're plant-based, and we've been invited, and we're getting invited less and less. Like we say we're plant-based because of this reason, but here's where we're wrong and here's where we've changed it. And even where we have changed our ideas. And that level of complexity makes people uncomfortable. Oh, maybe we shouldn't invite them. I say, your invitation is not as important as the facts. For example, with the idea of fish, we say we don't eat fish because of the oceans. We're, all this thing about what we're doing to the ocean. But the data shows fish is good for your brain. The data is there. It might be polluted. There might not be no clean fish and all of that stuff. But with the data so far shows this. And the omega-3 part, you can supplement, you can get these other foods. So we bring complexity, and that makes people so uncomfortable. In the world that we live in, there are battles around if there's olive oil introduced in a drop of food, you're kicked out of the whole forum.
Right.
Yeah, it's that level of simplification of conversation, which is bewildering. There was one of the big thought leaders in the community that said, who endorsed our first book, but didn't endorse our second book because Aisha used spray olive oil on the foods. Yeah. But that's reflective everywhere. It's reflective of people wanting to be part of a well-defined, unchanging, certain categorization, not one that moves with the data. And even the data should be analyzed in a way where the strength of the data is, with the omega-3, we said, there's not perfect data. We looked at all the data, and there seems to be a trend, strong trend. And here's the weakness, because the studies that were done, they were done in very low doses, and the effect seems to be at a higher dose. Like, we gave complexity. And it's frustrating. So your voice is refreshing in this environment. A voice of complexity that's communicated beautifully.
Thank you. That's very, very kind.
But I'm also very aware that we have audience who are either experiencing mental health issues or have a loved one who's going through it. With the ubiquitous nature of mental health in our society, I don't think there's anyone who hasn't been touched by it. And all of us, especially in the United States, the care that is provided is so dismal that, for example, it takes months for an individual to be able to see a psychologist or a psychiatrist if they have suicidal ideation. I mean, it's just ridiculous, right? You either go to an emergency room and wait there for 8-10 hours to be seen by someone if you're struggling, or if it's not, quote unquote, bad enough, then you'll have to wait for months and months for your insurance to approve for you to sit down with a human being and talk about something that is tormenting you. It's horrifying. So there are a lot of individuals who are experiencing mental health issues, who are experiencing even the beginnings of cognitive decline, which, by the way, never, ever gets detected in a community setting. You either have to have full-blown dementia to be able to be seen and have the conversation, or you just basically assume that that's a normal way of living. The first thing that we always try to share with individuals who may be experiencing some mental health issues is like, trying to find a quick fix for it is not the right way to do it. It's always very important for you to make sure that you speak with a healthcare provider to help you assess your situation, find out what's really going on. Nutrition may not be the first answer. You eating a quote unquote clean diet, which is, a word that I'm not very comfortable with, is not the way to do it. You need to sit down with someone to find out what is going on, what are the symptoms that you're experiencing. So that may be a clinical psychologist or a psychiatrist or a neurologist or even a primary care physician who can help you understand what's going on, because even the diagnosis is critical, isn't it, from your experience?
It absolutely is. But also, and I've got two thoughts in mind. So one is about the diagnosis and the other is social media. So I'll just park that for the
yes.
of course. But, you know, when we think about psychological or psychiatric diagnoses, we have to understand that what we're talking about really are syndromes. They're constellations of symptoms that can present in a similar way, but might not necessarily have the same underlying pathology. So one person's depression is different from another person's depression. One person's depression might be associated with a childhood trauma that they have not been able to process or work through. Another might be the unrelenting stress of having a horrible boss or having to work several jobs just to make ends meet. Another might be living in terrible housing where they just don't feel safe. And all of these things can affect the underlying stress biology that will affect an outcome of depression. So the very first thing that needs to happen is that it's not just good enough to have the label. Actually, ideally, and I have to say that obviously this should be happening for everybody, but I know it doesn't. Ideally, you're having an assessment so someone with experience can say, actually, these are your symptoms, you know, low mood or lethargy, tiredness, changes in your weight. Here's what I think is most likely to be driving it for you. These other factors are important as well. This is what I think is most likely to be driving it. And we can work on this in this way and then see what else we can do to help support your recovery. So there's complexity in the diagnosis. Depression doesn't mean anything in isolation. You need to contextualize it within that person's life and their experience. And this is where it's hell being a psychologist on social media.
Yeah, I hear you.
Because, and I understand, and I will assume, I will give the benefit of the doubt that most people are coming from a good place and they are well-meaning with the information they are trying to share, and that perhaps they had a good experience with this thing, this intervention, whatever it was, and that they are hoping to help people. I think there are some cynical people out there who don't come with good intentions, or come certainly for more kind of fiscal intentions. But I will hope that the majority of people are trying to be kind and helpful. But the problem is, unless you have had extensive training, you don't know what you don't know. And so there's an enormous amount of oversimplification of things like all of those posts that say, it's like,
I love your expressions. No, they speak to my heart.
Yeah, we the reason we laugh because we feel exactly the same way. Yes.
Just constant deep breaths. 5 signs you had childhood trauma, or 7 indications that you are highly functioning this, or 15 examples of anxiety disorder. And actually what they've done is to gather just kind of sometimes just indications of being alive, like, are you having these basic sensations? And then kind of wrapping them up in a diagnostic label. And it is so unhelpful. It is so unhelpful because as I say, sometimes it's just being human. Sometimes you wake up and you just don't feel good. You wake up on the wrong side of the bed and you feel a bit crappy, and that's just a human experience. And a lot of the time, often the work that I'm doing is letting people know or helping people work out how to just tolerate discomfort. I'm not going to take the discomfort away for you. I can't just do that overnight. Sometimes what it means to be human is just to tolerate the discomfort for the moment and to bear it and get through it. And then we'll carry on. It's not a sign that you're sick. It's not a sign that you're weak. It's not a sign that you're broken. You are a human having a human experience. So it's very, very worrying when you have groups of people kind of putting together what sound like convincing diagnostic indicators and then telling people that they're sick in a context where there isn't enough psychiatric or psychological support, and people can't get in to see their GP and they can't see a therapist, because then what you do is to terrify someone and then leave them unsupported, or you offer some inadequate support that isn't going to do the trick. So it's a minefield. It's a real minefield. It's a very, very worrying landscape.
Thank you for shedding light on that.
Yeah.
I think that's very, very important, because a lot of individuals they gravitate towards quick fixes because of the lack of complexity and constant source of help and guidance. People turn to quick fixes, and there are some charlatans out there that are making a livelihood out of this. And it's very dangerous. It's very dangerous because, like you said, at the end of the day, it's not helpful. And I feel like it actually even makes things worse, because if you don't find a solution for a problem, it only grows from there.
Absolutely. And it makes things worse in several ways. So one is that when it comes to psychological distress, one part is the distress itself. The other part of the equation is your attitude towards it. So if I feel, if I go through a bad breakup and I'm left with the feelings associated with that, if I have the attitude that, I'm not the first person in the world that's ever been dumped, and other people have gotten through it, and I can find resources of how to get through it, and I can lean on my friends and family, that's one thing. But if my attitude towards it is, there's something wrong with me, or I need to fix it, I need to change in some way, that actually compounds my distress.
Yeah.
So the way that we orient people towards their experiences is really important. And that's one of the things that I think a lot of people sharing this kind of information aren't really aware of. But the other thing is really the contagion effect, which we really, really need to be mindful of, which is that you can, in some sensitive and vulnerable people, engender symptoms that might not have been there had they not encountered this information. We've seen it most acutely with Tourette's-like symptoms, but I think we see it elsewhere as well. I think when you repeatedly, especially in young people, when you repeatedly encounter information that says, you're sick, there's something wrong with you, you're not well, there's something wrong with the way your brain works, actually it increases the likelihood of you experiencing those symptoms, the expectation effect. And we might be actually, in some people, increasing the likelihood of them becoming unwell or believing themselves to be unwell.
Wow. It's great. You brought up the concept of social contagion. And I think in the eating disorders world, this was very poignant and relevant. I think it was South Korea or someplace where there are certain eating disorders that did not even exist, or at least not to the extent that people would be able to record it. And then after that concept was introduced from the United States, it became a social contagion among the young people, teenagers. And that doesn't mean that we shouldn't address it. Of course, 100% we should address it. We should address it scientifically, with data, with underlying causes. But we should also understand that certain things should be introduced in a way. They should definitely be introduced, but we should be introduced with a priori knowledge in the community, with the community being ready to deal with it, not just throw something and say you're sick if you have the beginnings of these symptoms. One thing that, Kimberley, you said, which is incredibly important, in social media, a lot of time they create disease where there is none and a large population. Yeah. You're right. A lot of those symptoms are real human. I mean, I had never experienced depression. I had a shoulder surgery, which knocked me out for months. And I started experiencing this incredible feelings, and I shared it, and just as part of normal, experience, I got some help and all of that. But the importance is to know that these are real human experiences, and you don't have to call everything a disease. And that's where you come in. Your incredible work, and hopefully us as well, where we kind of give the appropriate weight of truth. I always say, it's not about truth. Everybody's telling the truth. It's the weight of the truth. If you over-exaggerate the truth, it's a fallacy. If you understate the truth, it's a fallacy. It's the complexity of finding this relationship with truth that's the job of the good scientist, good clinician, good social media, responsible social media person. And you're definitely doing that.
Thank you. No, I appreciate that. No, and the two of you are a beautiful example of that, and that's why I'm kind of was so excited when you invited me on. It was a real honor to be here.
Thank you.
That's very kind of you. So, given the state that we are in, where there's massive pseudoscientific conversation going on, oversimplification of very complex concept, and the overwhelming nature of mental health issues in our community. I'm happy that there are individuals like yourself, and there's some other fantastic individuals, mental health specialists on social media who are counteracting this false language and false narrative. That's good. We need more of that. Instead of shying away from TikTok and Instagram, I think we need to be more available there and break down this false image of addressing mental health issues are concerned. For the general public, though, Kimberley, when you encounter people who are experiencing mental health issues, what would your message be for them? You know, they're on social media, they're being bombarded with all these messages. What should a normal human being with mental health issues, either for themselves or for their loved one, do in this complex environment? Where should they get their information from, and how should they act? I know the easy answer would be stop and think before you take any action, but sometimes it's hard. What would you tell someone with mental health issues to do? What would be it?
If we think, let's say if we take the kind of common mental health concerns, I think probably one of the first things I would say is come off social media. Really, on balance, I would probably say come off social media. Whether that's because of the quality of the mental health information that's available on there, or whether it's simply just a source of stressful information. You know, there's a constant barrage of things you should be thinking about, things you should be caring about, things you should be talking about, people you should be following. This is what you should look like. It's just too much. Yeah. It's too much for people when you're feeling well. And it's just a kind of bombardment of information, certainly when you're feeling unwell. So if we're thinking more broadly about how do we reduce the amount of stress the organism is experiencing, then I would say that's a source of stress we can do without. You know, unless your livelihood is on social media, you're not going to lose anything from coming off there. Then I would say, you know, using that same kind of stress equation as a foundation, because, and the stress equation is, you know, the balance between the stress that's pushing down on you from the top, the demands, the pressures, and your denominator is your coping skills, your opportunity for recovery and rest. So how do we improve those things on the bottom? And so I would encourage people to do all of that self-care stuff. I often get my patients to do a 5-minute walk in the morning, and they will say, what's the point in 5 minutes? It's not doing anything. And I say, I know. It's just 5 minutes. What is it going to do? But it's not going to hurt. And lo and behold, they get outside, they move a little. There's a kind of inbuilt sense of kind of motivation. There's a sense of achievement. It's small enough for it to be a habit. You're getting natural light, all of that stuff. Give me 5 minutes of walk a day. And I will ask for nothing more. We'll try to focus on your sleep. And let's see if we can just get a few more nutrients in you. And that's just about supporting the physiology, just let's reduce the stress and make sure your body is trying to deal with something. Let's try and give it a little bit of support. And of course, absolutely seek out qualified support. So, you know, that we're not talking about one thing and one thing only. I really do think about what I call whole body mental health. We cannot, your mental health isn't neck up. Your brain is in your body. Your mind is an emergent property of your brain. Your brain is fed by your body and it's exposed to everything that's happening in your body. So when we're thinking about your treatment, we should be, you know, just keeping an eye on the body as well. But try to think of these as a kind of supportive, not kind of magic bullet answers, but kind of supportive ways in that are going to support your main treatment. And that should come from someone who is qualified and experienced in supporting you.
Beautiful. I love that so much.
And by the way, our first advice is 5 to 10 minutes of walk in the morning for multiple reasons. And if you want to do a little more brisk walk, because then that gets the blood flowing, all of that stuff. So it's amazing.
Yeah.
Speaking to the social media thing.
Yes,
I think,
I wanted to come back to that too.
There was a report by CDC, I believe, or one of that actually spoke to the fact that especially for young people, it's an incredibly damaging phenomenon to their mental health. And I think that one area that we've completely abandoned, and it's a huge area, is, and I don't know if it can even be controlled, is mental health, psychological health, sexual health, in the context of a ubiquitously present, ubiquitously available social media and internet environment for teenagers and young people. I mean, they're exposed to self-worth issues on a constant basis. They're exposed to false information and drugs and everything else. Sexuality sexuality is fantastic. It should be more available, more information, but in a proper way that is digestible for the proper given age. Whereas now pornography is ubiquitous in like 12-year-old young men. Are you kidding? I mean, so I think all of this was completely abandoned because we didn't know what to do with it.
No.
The same way that ethics is being. We just did 2 podcasts on AI, and ethics and AI. Like, my goodness, we're completely abandoning the most important thing that should be the front force in front of it. So internet and social media and teenage mind, I would love to explore that with you a little bit, because I think that's a field that we have really abandoned.
Yeah, and I think there is a growing consensus, and I know Jonathan Haidt is kind of one of the kind of lead speakers and thinkers on this association, and there seems to be a growing consensus in the research literature that actually something about social media that's just not good for developing minds. One of the things I had spoken about before, so I did a series a couple of years ago for Mental Health Awareness Week, is around the impact of social comparison theory. So we know that humans, we like to know where we sit in the social hierarchy, and we like to know who's taller, who's shorter, who's smarter, all of that. And that starts in the family. Often the family will say, you're the smart one, and you're the quiet one, and none of that is particularly helpful, but it happens. And so it's thought to be an innate kind of tendency. And that used to be fine because we were often just comparing ourselves to people who were either in our families or in our kind of geographic location. We might have been, in the past, generally probably related to them in some way. We were going to be broadly more similar to them than different. And social comparison breaks down into your upward comparisons and your downward comparisons. So your upwards comparisons tend to be either looking up at someone who you think is better than you. And 2 things can happen from that. One is that you can either find it motivating, like, oh, I can be that, and they stand out as a model for you. Or it can be demoralizing. If it feels too far away, I'll never be that. There's no point in me trying. I'll never live up to that standard. And then there's a downward comparison, which is often used as a very kind of flimsy bolster to your self-esteem, where you look down on someone else. You find someone who looks worse or is on some quality worse off than you and look down on them. So as I say, that used to be fine when we were broadly comparing ourselves to people on the same socioeconomics level or, someone who had a similar house to us. But now with social media, the notion for our brains of what a peer is completely destroyed. I might be sitting in my house in, a quiet suburb and comparing myself to a 9-year-old millionaire and wondering why what I've done wrong, why I failed in life because I'm not one of the 40 under 40 or whatever it is. When you see a stream of information that is partly your friends, partly billionaires, partly models, partly manipulated images, it really distorts your sense of what normal is, what normal might be for you. And I think that when you're thinking about a developing mind is really, really, really unhelpful. And I think it's very difficult when you're faced with that kind of information to think, actually, where I am is fine. And actually, I'm average. And I think we've diminished the notion of average or normal. Nobody wants to be normal anymore. We all need to be extraordinary. Unfortunately, most of us are normal. I have a post that says you're not special. And I say that as a kindness. I think it's, we're all just humans trundling along, doing our very best. We're still struggling with the same things we were struggling with 2,000 years ago. That's why I like to read some of the old Stoics. Seneca was talking about the same things that we're struggling with today. So much of human nature doesn't change, but we are fed this story and this message of constant striving and bettering, which I think is exhausting and unattainable. But if you're not if you haven't developed either enough life experience or the kind of critical thinking skills to know that, then you just spend all of your time, hours and hours all day on social media, feeling inadequate. And that is terrible for self-esteem and mental health.
Absolutely. That is probably one of my favorite posts ever. And I think the first line was, get over yourself.
Yeah.
Get over yourself.
Get over yourself.
Yeah.
Yeah. Yeah.
So
I loved it. I loved it.
No. It's completely understood.
No, yeah.
And it's so valuable. It's
right.
Normal is good. Normal is fine.
And people don't realize that when you're striving for something that is out of reach, or that attempt to be extraordinary, it can't be maintained, right? Especially if it's essentially in a way where you're essentially trying to meet a goal or comparing yourself to someone else. That can't be maintained, and over a long period of time, it's not only a failed attempt, but it's quite destructive for who you are and for the society and the community at large as well.
Yeah, and also that something's got to give. Like if I want to be the top, whatever I am in my industry, if I want to do that, I need to dedicate a lot of time and a lot of energy to that. And what that means is I won't have those kind of limited resources, those kind of resources that I cannot replace, time and energy, in immediacy. I don't have that to give to my friends or to my family or to my hobbies, my other pursuits. I have to understand that there is a cost. I have to decide that I'm going to be rubbish at some other stuff if I'm going to excel at this stuff over here. And I think that part of the message is never really given across. We're told you can have it all. And then when we start failing at having it all, we feel as if we're not working hard enough. I have so many people come to me and just say, I should just work harder. I should just work harder. I should be able to do this. I should be able to afford this. I should. I was like, there is literally not enough time in the world, and there aren't enough of you to be able to do all of these things. And you have to decide what you're either going to be rubbish at or what you're not going to be able to get around to at all. And then we're going to have to bear the loss of that thing. You might never climb Everest. I'm really sorry. You might never do it. And
so you don't think I can be a great guitarist? Oh my goodness. Okay. I have to give up that hope.
He's devastated right now, Kimberley.
I might need you as my psychologist.
Absolutely fine. But it's kind of bearing that sadness, bearing that loss, bearing that grief. We never have a conversation about that. We're told that we can have it all and be happy all the time, and that's just unrealistic. And so when people start feeling that loss or that sadness or a bit of dejection, they feel a bit disappointed, they feel like they're a bit overwhelmed, they start to think that there's something wrong with them rather than the system or the message.
Absolutely.
Beautifully stated. Thank you for sharing that. I want to kind of pivot the conversation a little bit towards a very important aspect of your message on social media, even though we're asking people to get off of social media if they have, overwhelming, which I completely agree with you, I think. I think that's very, very important.
Overwhelmed.
That they're overwhelmed. But a beautiful message that you share on social media is, I think it's a part and parcel of this conversation that we had that, mental health has to be personalized, it's nuanced, it's complex. But one of the aspects that is not really highlighted is culture. Culture and your background and how you define mental health and how you create solutions for mental health issues. For me, it's going to be very different for what it might mean for you or for Dean or for even our children who live in the same household. The definition of mental health and the solutions may be quite varied, let alone other traditions and countries and people from different cultures. We try to kind of see the solution as a one model fit all or a cookie cutter approach. As like, here's a brochure that I wrote and you apply that to your life and you're going to get fixed. I dislike those kind of messages, but you actually just kind of shatter that and you show the complexity and you talk about food and different flavors and cultures and mental health all mixed into it. It's absolutely beautiful. Can you kind of shine some light on that complexity for our audience?
That's really kind of you, because I tend to think of my social media account as quite random. Like I always wonder what people think if they've just arrived. What is this woman about?
No.
On the contrary, I think it's a beautiful representation of the human mind.
You might think it's random, but Jung would disagree. There's an archetype that flows. Yeah.
Thank you. Yes. So I think certainly in terms of the conversation and the narrative around food, because I became very aware, and I suppose I should hold my hand up, and perhaps for some people, I am part of the problem, because I do try to talk about nutrition and brain health. And I do try to say, this stuff is important for you. But what I try to avoid and to take active steps against is the reductionism of food down to just nutrients itself. And really the idea that there is one ring to rule them all, one diet to rule them all, or one way to rule them all. Because it's just not true. It's not even true in a single human lifetime, right? If it was true that we should only be eating one type of food our entire lives, then we'd still all be drinking breast milk, right? We know that there is specific food and specific nutrients that are right for a particular stage in your life, given all of this other information. And what I absolutely don't want to do for myself or for anybody else is extract the pleasure out of food. Food is one of the most accessible pleasures that we have. It is absolutely crucial. There's some really lovely research around the relationship between eating together and closeness in your relationships. And it seems to go in that direction, because you'd think, you tend to eat together more with the people that you like. Actually, the directional causality seems to be you feel closer to people that you eat with. So if you've got friends who are on the fringes or people you quite like and you think, I'd like to get to know you better, eat with them. And that will help to foster a warmer, closer relationship. Just the beauty and texture of food in terms of religious festivals and birthday cake and the symbolism of it. I never want us to lose that, because I think that is so much of the joy of life and the joy of eating. And again, to kind of keep those two things in balance. You need to eat well because, you want to be able to be well. But also part of living a good life, it's about being able to maybe share a slice of cake with a friend, or eat some ice cream when you're feeling blue with a friend, like that kind of thing. So never wanting to be kind of extreme about it. But it's a hard line to tread, and it's a hard line to make sexy on social media. It's a hard one to come over here and have a little bit of this and a little bit of that, and you'll be fine.
Absolutely.
No, that's where the complexity comes in. You're right. I mean, so it's who your audience is and where they are in their motivations and where the fact is, right? So we say that we don't like the word. Two words we hate is motivation and moderation, because they don't have a denominator. They're meaningless. They're just fillers to make people feel good about saying them. But the alternative is, here's the fact. This is the ultimate healthy diet. That's not even ultimate for you, but it appears that in this direction, more unprocessed, more plant-centered, more of this seems to be beneficial. We're whole food plant-based, but you can be healthy in many different ways, but this is one way. And that's, if that's your motivation, it's going to take X, Y, and Z. But reality is, it's not an all or none phenomenon. It's where you can actually make that first little change, if that's what you want, first of all. And if you want that little change, then make that little change. Like you said, I love your idea of 5-minute walk. We're nutritionists. We've mastered, but where we start is that first 5 to 10 minute walk in the morning, where it's the low hanging fruit. It's where the difference can be made, where the success can be felt, where the habit can be initiated. So It's the complexity of where the person is, what they want to do, where the data is, where you should start. And it should be like that. It's not, here's the 3 secrets to living well. There are no 3 secrets to living well.
Unfortunately, there are.
We'd all be, if these things worked, we'd all be 100 with 6-packs. Like we'd already be there.
Yeah.
So it literally, it cannot be the case. If it were easy, if it was simple, if it were neat and tidy, we'd all be there. But it's all messy. And one of the things I found that people really don't like to hear is that a huge amount of learning how to look after yourself, of learning how, learning what works for you, whether it's physical or mental health, is trial and error. Mm-hmm. You have to go off and you have to try this and see if it works for you. And if it doesn't, we'll course correct and we'll calibrate it a little bit. And then we'll try it again. People hate that. They hate, and I've literally had people say, no, just tell me what to do. Like, I know you've had training. I know you've been to school. You know how to do this. Just tell me what to do. And I feel sometimes people don't believe me when I say it's really not that simple, because what works for me in this moment won't work for you. It won't work for you. It might give you an idea of what works for you, but what doesn't work for you, so that you can get closer to what does. But it's so much is trial and error. And I think whether it's about loss aversion, we don't want the feeling of failing. We don't want the feeling of having wasted time. We don't want to feel as if someone else is overtaking us in the kind of race to get to the end, wherever the end is. We don't want to do that trial and error bit. And I think the more people can get on board with that, the better, because we do it with partners, right? If we didn't do trial and error in relationships, we'd all be married to our first boyfriend or girlfriend. Like, we would have just stuck with the first one and carried on. We understand that actually part of relationships is about learning about that specific combination. Learning, I kind of like this in a person. I don't like that. I'm like this with this kind of person. I'm different with this kind of person. And we understand that in some contexts that trial and error is suitable and valuable. And even if the relationship doesn't work out, you've learned something and you've taken something, and that can be really beautiful all by itself. But we don't want to do it with learning what foods are best for us, or learning what exercise we like. What's the best exercise? Well, it's the one you like and that you're likely to do. No, but which one is it? No, honestly, it's the one you like and are likely to do on a regular basis.
Beautifully stated. I think the phrase meeting people where they are is overused, and it kind of sounds simplistic, but that's exactly at the core of your message here. And whether it's in our clinic or in our research, that's the main concept. You provide information for people, but they really have to find themselves in it. And emphasis should be more on the journey of finding joy in the next step, rather than this unachievable outcome that everybody tries to create. And whether it's for brain health, mental health issues, physical health, whether it's improvement of relationships, and at the end of the day, just increasing the quanta of joy that we experience at every moment. That's the goal, to increase the quanta of joy that is created every moment, and for all of us to be the best versions of who we are. So we so appreciate that message that you're sharing with everyone.
And the book?
I didn't even get to ask you all of the fantastic questions that I have written for myself regarding your amazing book, Unprocessed, How the Food We Eat is Fueling Our Mental Health Crisis. But I think, Kimberley, that should be a part 2 of our conversations, don't you think?
Love to come back. I'd love to come back.
Yeah.
Yes. Amazing. Kimberley, thank you for who you are. Thank you for taking the time to share your brilliant brain and your experiences with everyone on social media, and for coming on to our podcast to talk about, which I know I'm biased, but it's probably the most important conversation, which is, our mental health and the decisions we make every single day to improve our mental health. Because at the end of the day, that's who we are, aren't we?
It's everything. It's everything about who we are. Your hopes, your dreams, your ambitions, your goals are all your brain. And so we should really be thinking about how we take care of it best. And actually how the other thing is how responsible we are for the well-being of others, because we all affect each other's nervous systems. We all affect each other. And so we should partially understand that we have a responsibility to others as well. We're all in this life together.
Beautifully stated.
Thank you so much,
Kimberly.
Thank you, Kimberly.
I look forward to the next conversation.
Thank you so much for having me.